Friends, I am Dr. Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 20, Ferrum phos.4. Ferrum phos for circulatory symptoms. Circulatory system symptoms. First or congestive stage of arteritis, phlebitis, thrombophlebitis, carditis, pericarditis, endocarditis, lymphangitis. Various types of inflammation. Arteritis, arterial inflammation. Phlebitis, venous inflammation. Thrombophlebitis, vein inflammation due to thrombus formation. Carditis, heart muscles inflammation. Pericarditis, heart muscle, heart covering inflammations. Endocarditis, endocardium means the internal layer of the heart. Lymphangitis, that is lymph vessels inflammation. In aneurysm, calculate a fluor to establish normal circulation and remove complication arising of excessive action of heart. Aneurysm means actually ballooning of artery. The artery forms small balloons various places. It is a very troublesome and painful, and actually not painful, it is actually killing disease, a killer disease. I will come to the picture immediately. Arising of excessive heart action, varicose vein, that is when the veins is swollen and tortuous and very painful disease. Calculate fluor also comes here. Cardiomegaly, that is heart is enlarged. Palpitation of the heart, quick pulse, full round. Now the pictures. First one is this is the layer of the heart. Over the heart there is double layer serous membrane. This is called pericardium. Inflammation of that thing is pericarditis. There is stitching pain in the heart. Endocarditis means endocardium means internal layer. The heart have 4 valves, we know, 4 chambers. The chambers are internally covered by endocardium. Inflammation of that endocardium is endocarditis. Aneurysm. This is aneurysm in the brain area is seen here. The artery forms small balloons here and there. When this balloon will burst, there will be bleeding and the patient will go into stroke, cerebral stroke. This is called ticking time bomb. Aneurysm is ticking time bomb. Ticking means it is going on. Nobody knows when it will happen, but it is ticking. And this is the varicose veins, tortuosity and swollen vein. Very painful disease and very difficult to cure disease also. Calcarea fluor beautifully act here, and also ferrum phos. Ferrum phos for back and extremity symptoms. Shooting pain in loins. Loins means kidney area. This is loin actually, loin area. Back, knees, ankles, lumbago. Lumbago is in actually rheumatism of waist. About 80% of middle-aged and upward of the world suffer from this disease. Worse from movement. Actually, this is about lumbago. This colon means this is lumbago number figure 2. This is lumbago actually have seen, and colon means this things relates to lumbago. Muscles of neck, back, arms, legs, finger, toes become stiff in cold. Worse for movement, acute rheumatism of joints with excruciating pain. Are all this covered by ferrum phos. In case of strain from a lot of physical work and sprain, the first medicine, joint inflammation from Spain. First joint inflammation, first medicine, always ferrum phos. Always ferrum phos. It is also joint. Ferrum phos for nerve symptoms. Post-inflammatory neuralgia. This is post-inflammatory neuralgia. Post-inflammatory neuralgia due to, you can call it sometimes like herpes, due to congestion after catching cold. Epilepsy due to congestion of blood in the head with fever. Convulsion of infants during teething. During teething, generally we use calcarea phos, but ferrum phos also helps here. Ferrum phos for skin symptoms. Ferrum phos is the second to none, mind this, second to none to ward of fever, pain, local distress, seen initially with inflammatory skin diseases like abscess, phelon. carbuncle, herpes, erysipelas, pox, measles. All the skin symptoms, when in the inflammatory stage initially, Ferrum phos is the medicine. This is erysipelas, this is carbuncle, this is phelon. Ferrum phos for tissue symptoms. To manage all injuries, bruises, sprains, wounds, burns of soft tissue structure, Ferrum phos is used internally as well as externally. Externally, mind it, wherever possible, you can use Ferrum phos, powdered Ferrum phos, mixing with sometimes in water, sometimes oil, sometimes Vaseline. You can apply if it is possible locally also, and in that period, if you give him orally and use locally, the cure will be sooner. Even to treat soft tissue laceration around fracture, note this is a fracture, and this is bone has come out, and here there are laceration of tissues. First medicine, Ferrum phos. Of course, Ferrum phos, first medicine. Ferrum phos is the first medicine to treat fever, malaise, soreness, pain after injury, burns. Very many times after injury or serious burn, fever comes. Very malaise, there is tremendous weakness, soreness, you cannot touch body parts, and severe pain. For dropsy, that is accumulation of water in tissue space, resulting after blood loss, Ferrum phos is used in conjunction with calcareous phos. If blood coming out of any place of body is bright red, mind is bright red. If blood coming out of any place is bright red blood. Not this is actually this blackish red actually after coagulation. This is also Ferrum phos blood, but after coagulation it turned black. But when it is just comes out, if it is bright red, then Ferrum phos is the medicine. And coagulates easily. Ferrum phos is infallible in these cases when the blood is bright red. Ferrum phos for special urinary symptoms. Special urinary symptoms with any disease, pass to urine repeatedly exist. If with any disease, passing of urine repeatedly exist, as for example with dysmenorrhea of women or with sleeplessness of one, then Ferrum phos is very effective. Ferrum phos for special symptom of injury. If after injury to any part of the body, the victim passes urine stool involuntarily, that is unconsciously, suffers from breathing difficulty, blood comes out during cough, all this happens after injury, then Ferrum phos can tackle the situation. Ferrum phos rheumatic symptoms. If after catching cold, muscles are stiff, benumbed and sore, or the same trouble is felt in neck arising out of bad posture of lying in bed, or if in any case of acute rheumatism there are redness, heat, swelling, fever, then Ferrum phos is the first choice. In first stage of rheumatism of articular joints like shoulders, hip, knees, ankles, elbows, application of Ferrum phos can nip the situation in bud. Remember, in hip joint disease, Ferrum phos should be used along with silicea. Characteristics: rheumatic pain shifts about. There is pain characteristics of rheumatism for Ferrum phos. The pain is shifting about, worse from motion, better from heat. At night, lower potency like 3x, 6x of Ferrum phos causes sleeplessness, but higher potencies do not. This is very important instruction given us by the most top-ranking tissue salt specialist, that we should not use lower potency of Ferrum phos in the night at the near evening, because this may hamper his patient's sleep. So try to avoid this. You can give 12x or anything else. Now, one very interesting picture I have given here. See, septic arthritis of hip joint. This is called hip joint disease. First stage means, note, just reddening of the joint is reddened. That is first inflammation. This is the first stage where you can use Ferrum phos. Second stage, the joint has almost broken, and third stage, it is fully out of the socket. It is just coming out of the socket. This is fully out. Various stages of hip joint disease. Mind it, this is a very, very painful and troublesome disease, if you can diagnose that this is a patient who is going to be affected with hip joint disease, then you please the first moment give Ferrum phos. Start with 6x or 3x and go generally upwards. The serious disease may nip in the bud. That is, at this you stop the medicine just with the starting. Life case: Mr. Motin Roy, age 45, reported that he had a dull pain on the right side below navel area for last 5 days. His face was pale, looked toxic. On palpation of abdomen, it was detected that the McBurney's point was tender enough and it was hot, slight fever, abdomen was swollen. On query, it was gathered that he had no appetite for last 3 days and nausea was increasing day by day. There was no stool for last 2 days. Neither did he pass any flatus. I suspected appendicitis. Immediately ordered for routine blood test and ultrasonography, lower abdomen, most urgent. Asked Roy to get test done immediately and produce the report. Now, what is McBurney's point? Mind this, McBurney's point. This is navel, and this is the ischial bone tuberosity. We can feel it with our finger just when you touch the waist area. Now, if you draw a line, then and you divide the line is 1:2. This part is 1, this part is 2. Whole line you divide into 3, then you come to first part in here. Now, this is the point. It's called McBurney's point. Generally, McBurney's point becomes tender when this inflammation of appendix occurs. Next day, blood report showed lymphocyte count low, monocyte count high. That is acute inflammation is going on. Ultrasonography distinctly showed inflamed and swollen appendix. I prescribed Ferrum phos 6x 2 doses too early for 2 days with written instructions. With written instruction, what is the instruction? If there was no remission of trouble after 1 day, contact then and there any government hospital, nursing home, because you know this appendix inflammation is a very serious disease, and if you cannot stop the initial stage, if it is burst out due to inflammation, the patient life may be in danger. That's why I give the instruction. Next afternoon, got a call from Roy that he was admitted in a hospital and doctors arranging for immediate surgery. That is, it happens what I presume may have happened. It is the case is so. That is, our medicine was not in a position to stop that inflammation. It already a advanced case. Thanks for listening and viewing. With this video ends. If anything you have got to say, please write down in the comment section. I will certainly reply.